The Department of Health led our state through the early days of an unprecedented pandemic. We're getting a look at some of the pressures state agency workers faced. And there's one program that some say didn't help. It's called Outward Mindset.
So right now it is still mandatory for every worker to complete when they're hired into the Department of Health. Fox 13's Nia Wong explains what the program is and why some say it's controversial.
Outward Mindset is a program developed by the Arbinger Institute, a training and consulting company. And the Washington Department of Health has made this program mandatory for all DOH employees. But hundreds of them are supporting a petition sounding off in the program that was brought in to foster more communication, which they say silences them instead. Outward Mindset is described by the Washington Federation of State Employees as mind games. And there's a lot to unpack with this training program.
And this is your introduction to the Department of Health and how we do things here.
When Rochelle Martin joined the Department of Health in 2020, she remembers getting a box filled with Outward Mindset books and materials like this, along with a 2-day training session that she initially thought was beneficial.
We're learning how to, talk to each other in a better way. This isn't really bad.
Martin's optimism for Outward Mindset started to fade as she learned how the complicated curriculum was impacting her coworkers.
Outward Mindset has been used as a tool to bully staff into being really quiet, into pretending that things are okay.
So what is Outward Mindset? Outward Mindset was created by the Arbinger Institute based in Utah, and the goal is to shift focus when problems arise. The program believes people who have an inward mindset may blame others or even avoid responsibility. In theory, the training is supposed to help participants empathize, but when put into practice,
it's very normal to have a facilitator or a supervisor or, some leadership members say, well, really, this could ultimately be your fault. So let's talk about how you are perpetuating this cycle of victimhood.
As a steward for the union, she's heard from members who are in anguish.
The mental toll that it's taken is so significant that people can't do their work.
The union provided testimonies from DOH employees, including supervisors, claiming, "My employees, who are people of color, queer, and/or disabled, feel very uncomfortable with OM overall. Outward Mindset is damaging. No science, not trauma-informed, and antithetical to creating safe spaces for employees at greatest risk of harm. Outward Mindset is triggering for trauma survivors."
People that are being victimized, they should not be forced to identify with their abusers. And that's what happens.
And the union is pushing for change. A petition that's collected more than 250 signatures demands DOH to make Outward Mindset voluntary and not a condition of employment. The union turned to Governor Inslee for help, sending this letter, which outlined problems. They say they never got a response, but Fox 13 did, with the governor's office sending us. Bottom line, the claims about Outward Mindset are false, telling us to go to DOH for more information, so we did.
We've been utilizing Outward Mindset for some time, and we have heard positive feedback from employees that this really has helped them to better engage.
Amber Santoyo is the Chief People Officer for DOH. She says changes have been made to some problematic parts of Outward Mindset materials, but we wondered how some of these messages made DOH feel Outward Mindset was a good idea in the first place.
I'm going to read you a page. In one of the Outward Mindset program pages, it says, "I deserve, I deserve, I deserve. No one could tell me any different until I listened. I don't deserve as much as I think I do." And then this is on the page. Do you see a problem with this? I don't deserve as much as I do.
I think we would need to understand more, just, at the concern of taking it out of context.
There's a Black woman on this page, and there's messaging below it saying, "I don't deserve as much as I think I do."
Again, I would need more information before speaking to that.
Do you find any problems with this messaging?
We sat down with Betsy B. Miller, showing her the same page that was in the Outward Mindset handbooks given to DOH employees.
It may be really leaving the message that they do not feel that they deserve to have the full level of equality in the workplace.
Miller has read the Outward Mindset books. With 40 years of experience with workplace relationships, mediation, and employment discrimination, she believes the Washington Department of Health should take time to reevaluate Outward Mindset.
There are some very strong, positive self-improvement messages that help leaders balance the need to meet goals.
But
There really are not references to DEI or diversity, equity, inclusion, and belonging.
as for the mandatory part,
I do think that it would be a great opportunity to put the training on hold, just suspend training for a period of time and be able to fully listen to the point of understanding.
confusing messaging that Martin says is just one of many red flags that have fallen on deaf ears.
People deserve a safe and respectful work environment, and the Outward Mindset curriculum does not facilitate that conversation. We should tell people you deserve all of these things, and we are here to support you.
The Department of Health says it doesn't have plans to let employees opt out of Outward Mindset, at least not for now, and that they're open to feedback. However, some DOH workers tell us Outward Mindset is so embedded into the agency that they can't give negative feedback on the program without fear of retaliation. We'll have more on that in our next segment. In the meantime, if you've experienced Outward Mindset and would like to share more, reach out to me at nia.wong@fox.com. In the newsroom, Nia Wong, Fox 13 News.